Shoulder rehabilitation has to be looked at in acute, subacute, and chronic phase, or bodybuilding. If a patient comes in unable to have their shoulder held by themselves, but they need a sling or a brace, then a very acute shoulder rehabilitation has to be performed. This is performed primarily by having the patient lie down, have the patient stabilize the bad arm. The first thing that has to be performed is working on pure range of motion, preventing a frozen shoulder. This is performed by the patient slightly tractioning the shoulder to a little bit of comfort and down with just a little bit of traction, and then working on flexion where the patient brings the arm up and never into pain. Once the patient gets to a point of discomfort, then they work it in that comfortable, short range of motion with a comfortable amount of tension where they're assisting with the good arm, working the bad arm into flexion. And they can bring it up in this, or they can bring it down and up several times into this manner. You work on flexion. You also put the patient over to the edge of the bed, and you take the elbow back and work it into extension, where you push the elbow back, back, flexion, extension, flexion, and you can work again into multiple extension where you work on just one spot. Again, remember rule 1 of rehab, never into pain. You then bring the elbow up into the neutral position and work on adduction, bringing the arm across, adducting the shoulder to the body, and abduction, adduction, and abduction, where the patient working the arm. Then they go in flexion, extension, adduction, abduction, all directions of the shoulder the whole time, stabilizing with the good hand. Next, the patient, when they are upright, can also use a broom, placing the affected arm at the top of the broom, grabbing the other broom down lower with your other good hand, and assisted flexion. Step down. And then lift this arm, primarily with this arm. You can also get a little closer grip, and using this as a lever, push the arm into extension, flexion, extension, flexion, and you can even use it to help abduct, bringing the elbow up by lifting it up and across. Very good. Next, once the patient is able to perform the range of motion, we want to start using, these are primarily a polishing activity to reduce scar tissue. Next, we want to stabilize the shoulder, or subacute phase. The thoracic or the shoulder stabilization is first going to be performed, which is what's called Codman's rotator exercises. I've often seen patients do this lying down, holding a weight. Personally, I like it performed by placing the tubing around both the patient's wrists, placing the tubing around the door, having the knots equidistant from the doorknob. This one's stretched more than this one. Make sure they're the same. Now, before you go back, start some light circumduction or Codman's exercises. Rotating, rotating, or just swing the arm back and forth, creating a little polishing, distraction, decompression of the shoulder, releasing of the scar tissue, and hydrolyzing the shoulder joint. Next, we want to work the stabilizing muscles of the shoulder, the trapezius, the rhomboid, the levator scap, and posterior deltoid by lifting the chest and doing a rowing motion, bringing the elbows back to a comfortable position. Once you have the comfortable position, you find a short isometric range of motion. From this position, you adjust the tube tension as far away from the door. Keep pumping. Don't stop pumping as you're moving. Adjust by coming back or forward while you're pumping, not so you don't move it and then pull and dislodge the shoulder. You do it until it feels better, and then you come closer. As you come closer, next you want to keep the pumping going, and just 1/8 inch at a time. As you're pumping, you start lifting the elbows and lifting the elbows with very little tension. It's comfortable tube tension, comfortable position, trying to get the elbows up, 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 up. Once the elbow is level with the shoulder, that's high enough. And now you start working back, adjusting the tube tension as far as you can go without any pain. Do it till it feels better, and then come closer. Next, take the tubing off. Put it around the affected wrist of the left arm, or left shoulder in this case. Take it off the door. Use the good arm, placing the tubing over the door. Bring the elbow down. Tuck it next to the body. Over the door. Hold the door with your belly so as the tubing cannot come off. Little finger comes to the front of the shoulder. Elbow tucked here, and then the motion is taking your elbow back to the scapula. Back, 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 back. This is working the anterior rotator cuff primarily. Some teres minor and lat dorsi. Do it till it feels better. Then place the tubing around the doorknob. Take the tubing off your wrist. Let's say it's now, this is the bad shoulder. Place the tubing around your wrist, under your thumb. Place the other tubing around the door. This is the position, closer with your hand, patting your side. Use the good arm to apply acupressure on the anterior rotator cuff, on the impingement syndrome, on the posterior rotator cuff, applying pressure, holding the shoulder into your body. This is the comfortable position. This is the comfortable position. This is the comfortable short motion. Adjust the tube tension by stepping away from the door, keeping your hand in the same position, patting your thigh, if that becomes uncomfortable, you can change the position by rotating the body, either that way or this way. Any angle that feels comfortable and relieves the pressure, and you can still do it, or relieve the tension by getting closer. Comfortable position, comfortable tube tension, comfortable short motion. Do it till it feels better. Then, this is the next position, keeping the elbow tucked next to the body. The further out the hand, the harder it's going to be with a larger lever arm. Bringing the arm back more inside will become easier. This is the comfortable position. This is the short, comfortable range of motion, working internal rotator or anterior rotator cuff. Adjust the tube tension by moving it further from the door. Do it till it feels better. Then come back. The next position is facing away. The hand up, arm tucked in tight, holding the shoulder. This is the position. This is the short range of motion. Adjust the tube tension by stepping forward. This is working pec minor, pec major, anterior deltoid, and anterior rotator. Next, step back. Now the shoulder's warmed up. Place the hand up behind your ear, left foot forward. This is called the baseball throw. If this is uncomfortable, bring the elbow down to comfortable position. This is the position. Short, comfortable motion is a short isometric baseball throw. Notice the tubing around the thumb. Adjust the tube tension by stepping away from the door. Do it till it feels better. Step back. Turn. Face the other way. This direction. Now, place the knot between the first or the second and third digit. Like this. Hold the shoulder. This is the position. Again, further out, the harder. Back in, easier. Keep the elbow tucked. This is the comfortable position. This is the short, comfortable range of motion. Adjust the tube tension by moving away from the door. Do it till it feels better. Then step to the door. Place the hand up again and elbow behind your ear. Move to your side just a little bit. This is the hardest of all the exercises. It includes all muscles, anterior rotator, posterior rotator cuff, as well as deltoid. Comb hair. It's a comb hair position. Elbow up, externally rotating the humerus. This is the position, the short range of motion. Adjust the tube tension. Do it till it feels better. And you're done. Next is a series of exercises for the chronic or the patient whose subacute shoulder has gotten strong enough that they can start performing the other exercises of the rotator cuff. Hold the tubing like you're holding 2 cups of water. Place the tubing under your foot. Use your little fingers to push the tubing away from you, lifting the elbows, pouring water onto your shoes. This is working the deltoid primarily. Put your hands together and push forward. Serve a plate. You do some shrugs. Place the tubing under one foot, elbow up, a press. Push the elbow up and back against the tube. Place the tubing around the doorknob and work all directions. This way, up, out, down. Lift one arm over your head and press. Up, medial, low, leaning forward. And that concludes the rehabilitative exercises for shoulder.